Thank you very much, Sheila, and everyone that is watching NBS Live at 9. I am in Seguku, where Professor Pontiano Caleb, the Executive Director of the Uganda Virus Research Institute, really resides. Prof, a very good evening. How are you?
Good evening. Happy New Year to you and the viewers.
We are wondering that what exactly is happening in China, and should Ugandans out there be worried at this moment of the day?
Okay, 2 days ago, through media and other social networks, of course, and many of you may have heard of new infections in China that have been reported, and with some hospitals full, congested, and a few deaths of a virus called the human pneumovirus, which causes cold, cough. When it gets complicated, you can get pneumonia, and it can result in death, especially in the young children and infants. So we have heard about those infections and increase in the spread of the disease. But I think so far we should not get too worried. Also WHO, of course, we are watching, listening, WHO, Africa CDC, USA CDC, and Minister of Health for guidance. But I think for now we should not get so worried. But we should keep a watch on this infection, which unfortunately comes at the time when we are really remembering 5 years ago when COVID started like that. But this virus is not a new virus, good enough. It was discovered in 2001, and the infections do occur. So let's just watch, and we shall continue giving guidance as we move on.
You're the guardians of our country when it comes to virology and also outbreaks that normally spark our country. What is the mortality rate of this virus so far, and what is WHO reporting?
The mortality rate has not much has been really given out. Of course, the China government has said we should be calm. These are infections that normally come during winter. They are respiratory tract infections, but there are those figures. Of course, we are seeing images of hospitals getting congested, and also a reporting of some mortality. We don't have the exact figures, but this is an infection that can cause death in children, those who are immunocompromised especially, and the elderly. Those are more at risk. But we are going to continue watching. My suspicion is that it will not be as bad as what we saw for COVID, but we need to keep a watch on what is going on.
Uganda is one of the countries that trades really highly with China. When you look at the imports in 2023, they almost accounted for 18%, meaning that many Ugandans continue to go to China. What happens to those Ugandans that are coming in from China, from Japan? Are you putting in mechanisms to see that we do not have cross-border transmissions?
I think we are going to keep a watch. The good thing is that we can test for this virus. In fact, this evening I was asking my colleagues whether they have ever detected. We have all the technology to detect for this virus. It's a virus that is spread in a number of countries. My colleague told me he's not sure, but we're going to check tomorrow. You may find we identified a few cases. So we're going to keep a watch. At this time, I don't think we are going to discourage people traveling. But as we said, we're going to continue monitoring what is going on. In case we need to test, we have the capacity to test for this virus. It's a virus that, as I've said, is not new. It has spread, and some people already have some immunity. Here in Uganda, we don't know yet. We're going to check this coming week on whether we have detected, because we have been quite active in surveillance for those who have acute respiratory tract infections, influenza-like illnesses, like this virus we're talking about. So we have been quite active and keen. So as we move forward, we shall be guided, and as UVRI, we are ready to do the testing.
As UVRI and all other partners, plus the central laboratory that we have, do we have the capacity as a country to really not be affected like COVID first treated us?
We have, since COVID came, and even before COVID, as you remember, when the COVID came, UVRI were able to detect the first case. We had all the technology, but even since COVID came, more technology has been added, and I can say yes, we have the capacity. I think the key thing is really surveillance. We don't work alone. We need to work with our partners in the Ministry of Health and others for surveillance. That's the most important thing. Surveillance and quick identification. If anybody's suspicion is patient, anybody is suspected, we have the technology to test for these viruses.
You have the technology to detect for these viruses conclusively. What is your message to the Ugandans out there that are trading between Uganda, China, and Japan, but also the population at large?
I think for the people who are trading now, they should not panic for now, but they should follow guidance as provided as we move on. I know China will provide guidance for those traveling there. Japan will provide guidance, but also WHO, Africa CDC, and our Minister of Health will make sure that we provide the guidance. For now, I think we should not panic, and we should just be alert. In case there's any danger, then the population will be informed.
Thank you very much, Prof. Nice serving you this evening. That's it from the guardians of our country, those that are out there to survey or to do surveillance of all outbreaks and normally come into the country. Professor Pontiano Caleb from the Uganda Virus Research Institute. Back to you, Sheila, the Political Command Center, to continue with Live at 9. My name